I'm Dr. Beatty at the University of Florida here in Gainesville, Florida. I'm a clinician scientist. I see patients with tropical illnesses, and my focus is those living with Chagas disease. I became much more interested in oral transmission working with my colleagues in Colombia, where we see many cases of oral Chagas disease throughout that country. In some areas, oral Chagas disease is considered the #1 route of transmission. And so with my colleagues at the University of Antioquia, we're trying to bring awareness of oral Chagas disease to these areas to help mitigate the spread of Trypanosoma cruzi. We found that this is actually much more common than we anticipated. We were able to review data from the public health services throughout the country. In certain communities, we found some common patterns where oral transmission is seen throughout the year at certain time periods. Our work in Colombia is to bring awareness to oral transmission of Chagas disease because of how serious that type of infection can be. I think it's very important to understand that with oral Chagas disease, an individual will be at risk for a serious infection that can lead to death. This is because an individual will consume many hundreds of thousands, if not millions, of infective trypanosomiasis, and they can quickly cause hypotension or low blood pressure and even attack the heart, causing fatal cardiomyopathies. Oral Chagas disease often leads to symptoms that would mimic other diseases such as malaria, and an individual may have fevers, lymphadenopathy, but will be very ill. It's very important that someone is treated immediately with antiparasitic medications such as benznidazole, which has been shown to treat individuals safely and prevent some of these life-threatening manifestations. Without awareness of these risks, one could have a delay in diagnosis, and this could end up being detrimental to that individual. So in areas where we have constant pressure from contamination of the parasite in the environment and with certain foods, communities will be at risk for oral Chagas disease, and it is important that we have access to antiparasitic medications like benznidazole or nifurtimox to help treat patients fast. Oral transmission of Chagas disease is not well known and well described, but it is being more recognized in endemic regions of Latin America and may actually be something of concern here in the United States. Here in the state of Florida, we recently encountered a patient who traveled back from Brazil, where we discovered that she was ingesting acai fruit directly on her farm, and we were concerned that she did acquire acute Chagas disease, causing her cardiomyopathy, and she's currently being managed with medications to help stable her heart.